Welcome to another episode of Med Madness, where we break down complex medical topics into clear and actionable insights. Today we're diving into post-traumatic stress disorder, commonly known as PTSD. PTSD is a mental health condition that can develop after exposure to a traumatic event. It's not just about experiencing something stressful, it's about how that experience lingers, disrupts daily life, and alters a person's mental state long after the event has passed. In this episode, we'll explore the clinical features of PTSD, how it manifests, and what makes it different from other stress-related disorders. By the end, you'll have a solid understanding of the condition and how it can be effectively managed. Next, let's discuss how PTSD typically emerges after a person experiences or witnesses a life-threatening event, such as a natural disaster, serious accident, terrorist act, war, rape, or other violent personal assaults. This condition is characterized by a pattern of symptoms that fall into four main categories: re-experiencing, avoidance, negative mood, and hyperarousal. Re-experiencing involves reliving the traumatic event through nightmares, flashbacks, or intrusive thoughts. It's as if the event is happening all over again, often triggered by reminders that are directly or indirectly associated with the trauma. Avoidance is another hallmark of PTSD. Individuals may go out of their way to avoid people, places, or situations that remind them of the trauma. This can lead to significant changes in behavior and lifestyle as they seek to minimize any connection to the traumatic event. Next, let's explore how negative mood and emotional detachment are common in PTSD. A person may lose interest in activities they once enjoyed, feel detached from others, or experience an overwhelming sense of fear, guilt, or shame. Finally, hyperarousal manifests as being constantly on edge, with symptoms like irritability, sleep disturbances, hypervigilance, and an exaggerated startle response. These symptoms can persist for months or even years and can interfere with personal relationships, work, and overall well-being. Let's consider a real-life scenario to illustrate PTSD. Imagine a patient, a middle-aged man who recently suffered an acute myocardial infarction or heart attack. After surviving the event, he began to feel increasingly stressed and overwhelmed. He started avoiding his workplace, where the heart attack occurred, and experienced frequent nightmares reliving the traumatic incident. His sleep was disturbed, and he found himself constantly on edge, easily startled by even minor sounds. Despite medical clearance that his heart was stable, his psychological distress persisted. This scenario is a classic example of PTSD where a life-threatening medical event triggered prolonged psychological trauma. To wrap up, PTSD is a severe and debilitating condition that can significantly impact a person's life. Understanding its symptoms and recognizing the signs early is crucial for effective treatment. First-line treatments include trauma-focused cognitive behavioral therapy, or CBT, and antidepressants such as SSRIs and SNRIs. Early intervention can prevent the development of chronic impairment and help those affected regain control of their lives. Thank you for tuning in to Med Madness. Don't forget to engage with our pre- and post-podcast quizzes and use the Anki flashcards we've prepared to reinforce your learning. These tools are designed to help you master the material and apply it effectively in your studies or practice. Until next time, stay curious and keep learning.